Hello, welcome to the Joe Cortez Show here in Las Vegas, Nevada, the entertainment and the sports capital of the world. Well, today we have a special guest who brings nothing but good information when it comes to combat sports. You know, you guys know I was a fighter for many years before I became a referee. I was in the combat sports myself as an amateur and professional fighter. Then in 1977, I became a referee until September 2012. So I did 35 years as a referee, and my main concern was the safety of the fighters. I don't want fighters taking unnecessary punishment. So today we have Dr. Shelly Bernick. Welcome to the show, Charlie.
Well, thank you, Joe. It's a pleasure to be here with you.
Yeah. Well, you and I go a number of years back when we were doing some studies with combat sports. And can you tell us a little bit about your background? You're a neurologist, and you've been in the field for how many years now?
Yeah, so I've been in the field of neurology for probably close to 40 years. But we became interested in just the long-term effects of head impacts, of repetitive head impacts. This was around the early 2000s when there were these incidents, generally in football players who had these tragic deaths, suicide, and they were found to have chronic traumatic encephalopathy, this disease that we know is related to repetitive head impacts. But at the time, nobody knew anything about them. We didn't know about the disease. We didn't understand how frequent it was, who's more susceptible to get it, how do you prevent it. So we embarked on a study, and this is when I met you, around 2011, so about 14 years ago, where we started following professional fighters, right. MMA, boxers, both active, retired, men, women, and would evaluate them on a yearly basis to try to understand really what are the changes that occur, can we identify injury early, what features might we be able to change to protect the brain. And I think over the last 14 years, we've learned quite a bit.
And now, do you tell me that dementia, is it mainly from injuries to that, or dementia comes just a normal individual that never fought in their lives?
Well, isn't that the trick? I mean, so decline in memory and cognition as you get older, I mean, in your 70s, 80s, I mean, that's a common thing anyway to occur. But what we're finding, or what was observed, and this was in boxers since the 1920s, is that individuals would develop dementia, this impairment in their mental abilities at younger ages, in their 40s, 50s, 60s. So we know that exposure to repetitive head impacts does change the brain, and it does result in a specific disease, which is chronic traumatic encephalopathy.
Now, I was a fighter myself. I fought 4 years in the amateurs and about 5 years, 6 years in the pros. And I mean, I got hit to some extent. I got hit sometimes in boxing. You always got to hit, no matter what kind of good defense you may have. But sometimes there's fighters that take too much punishment. Sometimes I blame a lot of that to the trainers, because sometimes you got to train the trainers, because sometimes trainers don't teach fighters a lot of defense. And I had a good trainer who trained me very well. Roberto Duran's trainer, Freddie Brown, he had me in the pros, but I had Johnny Monkel in the amateurs. But they taught me how to hit and don't get hit. So that helped me a lot. That's why at my age of 82 years young now, I still feel like I'm 22.
Yeah.
And my mind is still sharp. I do my shows for the last 8 years. I've been doing this show, and I try to keep myself mentally sharp and also exercising my brain, like what we're doing today. We're talking about, so I keep my mind always thinking about things, not only just boxing, but in life in general. I'm always trying to keep myself going and try to share my knowledge and wisdom, which is what we're doing today with you guys. Dr. Shelly Bernick here from the Cleveland Clinic, who's amazing, has so much information to share with you. So this is just the beginning of our show. So I ask you more questions. Now, in MMA and boxing and football, what have you determined the cause of these dementia or brain injuries that they have?
Yeah, I think without question, the major factor in causing a long-term effects, which is like CTE, is the amount of head impacts you get. And they don't have to be concussions. It's just the repetitive hits that occur. So, of course, as you might imagine, boxing tends to be more effective. So there's a higher risk in boxing. MMA actually is much lower, probably because there's other ways to win. I mean, by submitting somebody and so on, and they don't get quite as many blows to the head. Your point, I think, is really the important one. Even though we watch the fights and people do take a lot of punishment at times, and many of them go on too long, which I know we had talked about before the show. But a lot of the injury comes in training.
Right.
And when you mention about the trainers, training the trainers, that's, I think, the area that probably should change or needs to change the most. Exactly. That is limiting sparring, using some of our measures that we have now to determine how a person is doing during their training, the 8 weeks or whatever they train before the fight, and modifying their training based on some of the ways that we can measure brain function.
Exactly. Sometimes you get a fighter that's quick with good defense. He's always moving. But some fighters, you come in, they come straight forward, trying to slug. They call it a slugger. Mm-hmm. But you kind of find a good boxer like a Sugar Ray Robinson or a Floyd Mayweather. They had good defense, and they have good offense, but mainly defense is very important. But a lot of trainers don't train the trainers the right way. They train the fighters the right way. Sometimes you get a trainer who's been around the gym. He never was a fighter, never was in professional boxing, but he was become a trainer, and now he's training these young kids. I see young kids, 8, 9, 10 years already, banging away. They're taking the blows to the head at a young age. That's going to have an effect on them because, their brains are not really fully developed at a young age, and now they're getting in their teens, even in their early 20s, the fighters are already walking around with punch drunk syndrome.
Well, your observation is exactly what we found. That is, individuals that started their boxing career before the age of 13, even if they've had the same number of fights, by the time they're older, the ones that start earlier have more damage. So that's absolutely true. And I think what we found, which I think is really interesting, is that as a person transitions from their active fighting career to retirement, many actually improve. They improve on tests of reaction time and things. So sometimes you would think that a young fighter, that doing a lot of sparring actually sharpens them up. But in some sense, it may actually be a disadvantage because they lose. What's happening in the brain is they're losing their reaction time. They really aren't mentally as quick, and I think that's often overlooked. Just this whole idea that you have to fight, spar and really to perfect these things, I think is a mistake.
There's fighters out there that have good reflexes. They have good ring mechanics. They look like I refereed George Foreman when he was 45 years of age. He became heavyweight champion at the age of 45. Now he became champion when he was 21, at the age in his early 20s. And then he became champion when he was in his 40s, 20 years later. But he seemed to be pretty sharp. Even at the end, after he retired, he seemed to be pretty sharp. He died unexpectedly, but I don't really know what was the cause of his death, but he seemed to be pretty sharp. At the end, even the year before he died, I would spend some time with him. We would be talking, and he was just normal as you and I can be talking. And I said to myself, this man's pretty sharp, But he was a banger. But some of the guys that he used to knock out, most of those guys, they're not around today. And those who are around, they don't even know where they're at. They don't know they're in the daylight or nighttime. It's just unbelievable the way they are these days.
Well, I think that's another point that you bring up, which is you can have fighters that seem to come out okay. And, you say, well, why is that? They got hit just as much. But so there probably are other factors, genetic factors, the way the brain can respond to inflammation and repair itself, a person's lifestyle after they stop fighting. So, some people get into alcohol, they get into drugs, they have whereas other people take care of themselves. And all those things make a difference probably in your ultimate outcome.
Exactly. And it's something that we try to learn and see. That's why I had to bring you on the show today. I want our viewers out there to understand that you're not a fighter, but you take care of fighters to see how come they act in a certain way. Leon Spinks, I'll give you an example. Leon Spinks, he beat Muhammad Ali back in the late 70s, and Ali was not the same fighter, but Leon Spinks became champion. Mm-hmm. But Leon Spinks was Olympic champion, but he did a lot of fighting in his day. He took a lot of punches to the head, and at the end of his career, he was also taking punches, even though he beat Muhammad Ali. But he was one of your patients at the Cleveland Clinic after a while. What got Leon Spinks to go to your clinic?
Well, he participated in the study. And I think that, that's really what we're so grateful for, that people in the profession are willing to give back, to participate in studies like ours, to allow us to learn, why some people do well, why some people don't, and develop tools to recognize injury early on so we can prevent further damage.
Right. Now, I know his wife Brenda, would they call me up and say, Joe, Dr. Bernick wants to talk to you about Leon Spinks. I said, what do you want to talk to me about? He wants to know how come Leon now is doing something different. He's acting a little different. He has a better balance. His vocabulary is getting a little bit better. He's able to communicate better with people. And you called me up one day, and I told you, Dr. Bernick, you want to see what I'm doing with Leon? Come on over to my house. And I had a professional boxing ring in my house.
That's right.
Remember, I put you in the ring,
yes,
and you put the gloves on, and I had the mitts, and I had you trying to do what Leon Spinks was doing, and you didn't know a left hook from a fish hook.
That's right. Yeah. Now I really appreciate the skill it takes for a boxer.
But Leon Spinks, even though he was suffering from that dementia, I told him jab, right hand, left hook, and he would do it like nothing. And and I was telling you, you didn't know, you couldn't even throw a jab in a right. You didn't know what you were doing.
That's correct.
Then you said, well, wait a minute. And then I said, Leon Spinks is doing something that he's been doing his whole life. And even though he has dementia, he can communicate when it comes to boxing.
Well, that's it. And I think it really shows that there are ways to the brain has what we call plasticity, that it can form new connections and so on. So even if somebody has damage, if you work with them in certain ways, in the way you did with Mr. Spinks, it can be helpful. It doesn't cure it, but it has a beneficial effect.
Yeah. You told me, Joe, you may be onto something.
Yeah.
I like what you're doing. Can you come up to my clinic? I want you to be my staff. And you took me up to this meeting. There was about 10 individuals sitting at the table, and we all started talking. And one of my questions to them was, how do you guys figure how many punches the fighter took to the head? And they said something like, well, we look at the records, how many fights he had, how many rounds he fought, and then we figure how many punches he took per round. I said to them, how about all the rounds that he sparred in training?
Oh, sure.
All the rounds in training, how many rounds do you think he sparred? Maybe 100 rounds to fight 10 rounds. And they said, wow, we were not taking that into consideration at the time. You see?
Yeah, no, absolutely. And although it's interesting now, there's technologies, I don't think they've been perfected, but with mouth guards that can actually measure the amount of head impacts a person has, sensors you can put in the gloves. So I think things are moving, just like everything in our society, moving to this technology to help us really measure some of those things you're mentioning.
Do you think AI is going to help us a lot with this?
100%. It already has. Yeah, it already has.
You're using AI in your clinic?
Well, we're using it to develop ways to recognize what we think is CTE while a person's still alive. Mm-hmm. I mean, at the moment, that's a diagnosis you're going to make it at autopsy, at death. But having all the thousands of scans we have and blood samples and other measures, the computer can actually come up with profiles. And it can tell, if you put all the data in, it can actually tell you who's most likely to have the disease. Mm-hmm. And it's not perfect yet, but that's how AI can help in many ways.
Do you think age has a lot to do with this?
Well, the older you are, the more likely you're going to have problems, or the worse it's going to get. Mm-hmm. So there's no question that age is a factor. And as I mentioned, starting early, that is a younger age where you start may be a disadvantage too.
No, they have with the MMA, you have MMA, you got football, and you got boxing. Any other sports you're working with?
Absolutely. So when we find something like in boxers, the question is, does that apply to everybody? I mean, everybody that gets concussions or get hit. So we've added actually rodeo. This is rodeo week here in Las Vegas. We've added hockey, and we've added motor sports because it turns out that there's a lot of concussions even occurring in motor sports. Yeah. So trying to understand if some of the findings we've come up with within the boxers and MMA fighters apply to other groups as well.
How about individual regular driving? People have accidents driving cars. There's a lot of accidents today, something like racing cars. But I'm talking just in normal life. You have an individual may have a lousy driver. I got a brother of mine who's a lousy driver. Maybe you get to 3 or 4 different accidents, pretty serious stuff.
Yeah.
You make it, but your mind, mentally, you got some brain damage.
Yeah, I think there's 2 situations. So one is where you actually do have a what we would call a traumatic brain injury, where there's a distinct event, a car accident, a skiing accident, and your brain is damaged. There's no question. Then there's the issue of people that just get repetitive head impacts. So probably regular driving is not as likely to do that, but some other, even for example, it's kind of interesting. The Olympic Training Center is interested in luge because when their athletes go down these runs, they're going at high speeds. They're just rattling around.
and your brain.
You're just rattling around.
Your brain's like a rolls on a stem.
Yeah, so
it's in there going all over the place.
So it's really interesting that a lot of sports where we don't think about it, may have the same issues.
There's a lot of fighters that have injuries while training, and I did a little interview last week with at a local studio about. We had Rick who can show you a little bit of our show interview I did last week. All in training, and next week they're gonna fight. They don't say that to nobody because they don't want to lose that paycheck. They have him fight, and the fight he ended up in a coma because he came in damaged goods when he fought the following week. If a fighter gets hurt in training, gets knocked out in training, he should not be fighting. But everybody zips it up, don't say nothing, and the fighter goes out and fights, and he gets hurt.
And we've seen that.
And that's what I'm saying, that the commissioners should have like a scout, a chief out there, going to different gyms and talk to the gym and make the gym owners accountable. If you're the owner of a gym, you're running a gym, you got to make you accountable. If you see a fighter get knocked out, you should report that to your local commission. If fighter so-and-so got knocked out in training, my duty is to report it to you guys. We don't see him come back and with damage goods into a fight. So a lot of these things, a lot of commissioners got to listen. That's why I'm talking. I'm talking with experience. I know the game, and I know what's good and I know what's bad. I'm going with the safety first, and then the business part comes after. Well, you see there, Dr. Bernick, that's another thing, that fighters get hurt in training, and I think the gym owners should be accountable. They should report that to the local committee. The fighter got knocked out, he was out, and he's fighting a week later. Going there's damaged goods,
That's right.
He had no time to recover. And that's where a lot of these gyms, I go to some of the gym and I tell the trainers, why are they fighting so hard? Why? It's supposed to be a sparring session. These guys are banging away like they want to knock each other out. And then there's a big difference in weight as well. It may be a lightweight fighting a middleweight while training. So one guy is much stronger than the other. That means the punches that he's throwing are really good knockout punches. And the guy takes it pretty good. And he looks okay, but in the long run, you can see the effects.
Yeah. Well, you can see all your ideas are good. I guess it's, how do you implement them? I mean, I think if commissions can start by, let's say, requiring training of trainers, or just as you said, requiring gym owners to report concussions, or I just don't think we have enough information, right. One, and two, I think it's, the problem is how do you implement it, particularly if somebody, they train here before a fight, then they go back home and they're but that's what's needed. That's what you really need.
Exactly. Yeah, we've got to do a little bit more research on the blows to the head for these fighters, football, racing, MMA. Now, they also got the slap thing. They got that new slap thing now.
Yeah.
That slap thing, I'm not too much in favor of that, because then there's no defense there. How hard of a punch slap you can take. And I think that's going to cause some injuries, some permanent damage down the line.
Yeah, I can't comment too much. I mean, it doesn't sound like it makes a lot of sense from a scientific standpoint. I mean, I know it's entertainment. That's what it is. It's entertainment. But certainly, yeah, I mean, what's going to happen to some of these guys, down the line, it's hard to know.
Yeah, I got good defense. I even when I playing ping pong, when I ball hit against the head, that little ping pong ball,
yeah.
I said, wait a minute, I got hit that. I shouldn't have got hit with that ping pong ball.
There you go.
But I mean, everything is kind of just a lot of studies. We have my co-host Shelly Stevens now on the show today, but every week they perform. Tonight they'll be performing at the Lola's Friday night, not Saturday night, because they got a special engagement. But tonight they have a Lola's. Shelly and Wesley, there they are. My good friends. Wesley was a combat sport himself. I got to send him to your clinic. He was be with the Commodores and the Stylistics. I'm going to send him to your clinic, see if he has any brain injury, this guy.
All right.
Good guy. But anyway, there's Shelly and Wesley. You guys watching out there? You five fans out there watching boxing, football, hockey, like Dr. Bernick is talking about. So many things so important that we have to really look into. Not only just your life in general, but keep yourself sharp and your children, teach them to have a good, if you go into sports, have good trainers. Trainers are very important. Sometimes, like I mentioned before, sometimes you got to train the trainers, because making sure that they teach these kids good defense, how to win, how to hit and don't get hit, But it's a tough game. I mean, I did it for so many years myself. I only lost one fight in the pros and 2 fights in the amateurs. I only got knocked down once in training, but in a real fight, I never got knocked down in amateurs or professionally. I had good defense, know how to get away from punches. I would jab, and move, constantly moving. You couldn't hardly hit me. I came out with no cuts, no broken noses. Everything was good. But we don't what we need today. But trainers are so important. You guys out there, please, if you don't know much about boxing, don't be training these kids to go out there and slug it out, especially these young 9, 10-year-old kids. I see them compete in these amateur tournaments. One guy I saw one day that was really good at 10 years old. Mm-hmm. That was Devin Haney. He's a world champion right now. He was 10 years old. I met him at Mesquite, and I said, "Come here, young kid. Who's your trainer?" He said, "My dad." "Bring your dad, Bill." He brought him over. I said, "Mr. Haney, this kid got championship material. He's going places." When he was 20 years old, he was world champion. And the kid worked out to be a good, decent fighter with good defense, and turned out to be one of the best ones in boxing today. He's fighting in the next couple of weeks. But you fans out there, this is why I bring people on my show to give you information in reference to combat sports, out of safety, health, and keeping yourself mentally sharp. If you have any issues, if you have any mental issues, one of the things I want to ask you, Dr. Bernick, when somebody feels something abnormal from a combat sport, whether it's MMA, football, boxing, when they feel something abnormal, what are the symptoms that they feel?
Well, I think it kind of depends. There's several situations. So one is a concussion. So you get a hard blow to the head, and you don't have to be knocked out, but usually a person's dazed or stunned or they're kind of wobbly. But then afterwards, you can have other symptoms where you feel fatigued. Headache is a common one.
Nauseous.
You could be nauseous. You could be dizzy. You could be moody. So those are kind of common things that can happen after a concussion. It doesn't have to be that severe necessarily. And then other people don't have a distinct concussion, but if they've done a lot of hard sparring, they may come out and just feel wiped out. I mean, just mentally wiped out, and not processing things as well. And again, depressed. So you can have some of those symptoms without even having a quote unquote concussion. So I think those are the things people should watch for. And if those occur, then of course you shouldn't be sparring until you're totally recovered. And if they haven't recovered in a couple of days, then they should really see somebody, a trainer or somebody.
Now, some fighters, they take blows to the head, and they don't have no symptoms at the moment. But like you said, later on, maybe their attitude changes. They seem to get angry quick. They wonder, he was not that way before. Sure. And those some of the signs, right? But when they see something like that, they should go to a doctor and report. Yeah,
I think it's better to go earlier than later, because the longer things fester, and this is true of a lot of diseases, the harder it is then to treat it. Right. So the more on top of it you are, and sometimes that means not necessarily you can't do anything, but certainly staying away from, for example, sparring for a while until you're truly recovered. And there's protocols, return to play type protocols that have been published, and we'd be happy to share. But for sure, if somebody's having symptoms, the worst thing probably is to go back and keep sparring. Yeah. Some of these some of the trainers. That's why I say the trainer is very important, because the trainer says, "Wait a minute, he's not acting the same he was last year. He's not as effective as he was. His reflex, he's getting hit more now than he did before. Sometimes you lose your balance. Your reflexes are not there. You don't know whether your timing is off. Good trainers can see that. Well, and as you know quite well, when a fighter, particularly as they get later in their career, once you've had a concussion or two, it takes less to cause another one. So they get the jaw thing where it doesn't take much to knock them out. So as that starts happening, then you need to pull out. Otherwise it's just going to get worse and worse.
And this is where I tell the fighters, or the trainers, they should say, I know this kid is not the same anymore like he was before. Maybe I got to stop holding back, not have him spar with heavy weights, and he's only a lightweight. And he got knocked out in the last couple of fights. Maybe I start talking to him about maybe retiring because he's going to keep taking this kind of punishment.
That's right.
It's only going to get worse. In the long run, this individual will not be walking straight. He'll be walking on his heels and then not thinking straight and not be able to have a normal conversation with you. And this is why I say to these fighters out there, I better get out a little sooner than later. But you know what? If you're thinking about quitting of boxing because it's a blow to the head, maybe become a referee like I did. I decided, you know what? I don't think I'm going to do this no more with boxing, but I love the sport so much, I stuck with it.
And you were fair but firm.
Fair but firm.
Yeah.
I was always fair but firm with the fighters. They knew, I don't care if it was my brother in there, you give me a foul, I'm taking a point. And that's another thing that the referees got to look and think about. Just because it's Mike Tyson or Muhammad Ali or the great, Sugar Ray Robinson, I don't care if you're refereeing those guys. If you can't deal with that pressure because these are the big name fighters, you're afraid to pull a trigger and say, I'm going to take a point. Like in Mike Tyson's last fight, I took 2 points from him for headbutting Kevin McBride intentionally and cut him. And then I grabbed by the wrist and I took him to the 3 judges, 2 point deduction, headbutt. And then at the end of the same round when the bell rang, Mike was so exhausted. He wasn't hurt, but he was so exhausted. He went down from a push, and when he got a bell rang, he got up. I walked him to his corner, and his trainer looked at me, Jeff. Anyway, he looked at me and he said, I don't think so. And I said, no. I felt the same way. I waved it off.
But I'm guessing there's a lot of pressure on the referees, particularly in big fights, because of the money, the betting now and the pay-per-view, and people want these fights to go on long.
Yeah, I know. People want them to go on long, but as a referee, your job as a referee would be the safety of the fighters. First and foremost is safety. So we don't care about how much money they're going to make or how much they're going to lose. No, you're there to do a job, and it's to protect these fighters from taking unnecessary punishment. And I think that's what we train the referees, these boxing commissions and those sanctioning bodies around the world. Like right now, they have a commission, a sanctioning body in Thailand, WBC. They're having seminars for referees and judges, which is good. Every state should have at least 1 to 2 seminars a year, and having doctors involved in the training seminars so doctors can communicate with the referees. You may be a good doctor, but you're not a good ringside doctor. No. So we want a doctor that understands the sport. So these doctors should be mandatory that they attend these conventions and be there with the referees, communicate. So this way, we had a doctor here, she was a neurologist, Dr. Margaret Goodman, who used to work ringside. She was a good ringside doctor. And her boyfriend, Dr. Flip Mansky, they were both good, but she was a neurologist. Right. And her, you probably met her, and her and I worked together. We were good working together to fight. When I told her, when the bell rings, always be looking in my eyes. If I look at you, I want you in there, just by me looking at her, she already knew she would come in automatically into the ring to check the fighter. Sometimes we don't want the fighters to take too many blows to their head. Yeah. Some of them they let it go too long. So as a referee, I don't care. Like I told Mike Tyson, Mike, you could be the baddest man on the planet, but I'm here to protect you. You understand? But I'm here to also enforce the rules. But safety comes first for you and your opponent. I talked to Mike Tyson. I talked to Roberto Duran, to Sugar Ray Leonard, Lennox Lewis, you name them. All the great fighters that I refereed in 176 World Championship fight, I told these fighters, I'm here to protect you and to protect your fighter.
But they probably respect you for that,
they
right?
Have to. That's why I'm fair, but I'm firm.
Yeah.
Yeah. And that's the way I've always been my whole life. As a referee, I try to do the best I can. That's why I bring people like yourself, a doctor, to talk to individuals out there so they can learn a little about what goes on behind the scene. Sometimes the fans want to see these fighters slug it out. There's knockdowns. Each fighter get knocked down. They get up. Come on, get up. And it looks good for the fans, but really for the individual, it's not good.
No, and actually we did a study looking at reviewing fights, and it turned out the person that had the first concussion that we could identify lost most of the time anyway. Right. So to keep it going on, for the entertainment, that's fine, but for that person's health, it's not fine.
Exactly. That's why we have to kind of go to the local commissions. You have like a soldier, like I mentioned on my interview before, I did doing the show. You need a scout, a chief, somebody go around to different gyms and just go around and tell these gym owners, listen, it's mandatory that you let us know. If you don't, we're going to pull your license. You can't operate a gym. There's a lot of gym owners. I don't think they even have a license to have a gym, to operate. You got all these fighters' lives in your hands. You're having these trainers that you bring in to train these fighters, but they're not qualified. You have to make sure these are qualified trainers, making sure these kids can go back home to their family one day and not end up with punch-drunk syndrome. With that said, my friends, this show is all about helping the people out there. It's not about me. It's about you. You take care. We'll see you guys next week. And don't forget, here I got my undisputed champ, Dr. Charlie Bernick. Okay? Mr. Fair but firm, Joe Cortez, and Dr. Charlie Bernick. See you next week. Bye-bye.